So this is a deep transverse friction technique shown on towards hamstring muscle belly. So because the technique's in a muscle belly, we want the tissue in a shortened position. So I'm going to rest the leg on towards my thigh so the muscle's nice and relaxed. If it was a ligament or a tendon, it should be in a stretch position, not in this case. And then this is a technique that's specific to where you've identified scar tissue to be present. So we're going to assume, and which you'd find from good effective palpation and also from a good examination, just for the purpose of demonstration, we're going to assume there's a small portion of scar tissue in the mid-muscle belly of medial hamstrings here. So these techniques are going across the fibres, and your contact point wants to be a thumb or a reinforced finger pad. We'll show both. So your thumb should be applying pressure directly on towards the site of scar tissue, and your thumb will be reinforced by using your opposing hand, and your pisiform again will be placed on top of your thumb. So you're applying direct downward pressure in towards the muscle belly, and then you're moving across the fibres. So my thumb isn't moving on the skin, it isn't doing this, it's putting direct pressure down on towards the tissue, and it's moving over the deeper muscle belly rather than just the superficial tissue. If you're doing that with your thumb extended, and it's going to really compromise your smaller joints and it's going to cause you some longer term issues. So thumbs are good, but just really make sure they're reinforced with your opposing hand. So this hand on top, direct downward pressure, and you're doing a deep transverse friction. So you're applying your force perpendicular to fibre direction. And you do this technique for about 2 to 2.5 minutes before you're going to take a break. At that stage, you could do some gentle kneading techniques and gentle stretching techniques to give your patient a bit of a break from what are deep, painful techniques. Then you'd apply your pressure again. So you're looking to achieve 10 minutes worth of treatment time. So roughly 4 times 2.5 minutes with natural breaks, so your patient gets a bit of respite from that discomfort, with the same technique applied. So just to reinforce, these are techniques that are specific to sites of scar tissue. Your points of contact are going to be either your thumb, which will be reinforced, or a reinforced finger pad. Your direction of pressure is going perpendicular, so cross fibre to the muscular direction. And it's a deep, and it can be really quite a provocative technique that should induce a bit of discomfort on your patient.